implement solutions to bring this work to scale, national scale, all these words that you've heard throughout these introductory remarks makes him the perfect speaker for us today. David's been a great friend of our school and to our faculty on our network. He was one of our keynote speakers on October the 2nd, with the launch of this very room in this very building. So please join me in welcoming the great David Bornstein.
That's truly the best. I'm going to have to take you on the road with me. I'm going to take Matt. Well, thank you, Dean Lawler, Chancellor Wrighton, Michal, everyone from Centene. This is the fourth time I've been here, and it's a great honor to be here. And I really share the vision for this partnership. I mean, we've been talking to Dean Lawler about ways of getting evidence into journalism, and we want you to add journalism to your slide as one of the many partners there, because it's really important for the great knowledge here and in other academic institutions to get out to the public so they can really understand how to solve social problems. Dan sort of scared me when I was walking into just before here, we met in the bathroom, and he said the worst thing you should ever say to a speaker before the talk is, do you have a joke? And I said, no, should I have one? So he told me one in the bathroom, which I couldn't possibly repeat. But then I thought, well, actually, I was thinking about behavior change, and my nephew actually told me a joke last week that I thought was very funny, but it sort of gets to the idea of behavior change. He has ADD, and he said to me, how many youths with ADD does it take to change a light bulb? And as I was thinking, he goes, let's ride bikes. So this kind of gets to the challenges that we're dealing with when we deal with behaviors. Everyone's carrying something a little bit different inside their heads. And I've done a lot of reporting. We've been doing this column for 5 years, looking at solutions to social problems. And one of the themes that has come up most often in my reporting, I've probably done about maybe 30 or 40 articles that look at some dimension of how people are trying to help young people who have had trauma in childhood. And I was very moved. A long time ago, a couple of years ago, I came across a study called the ACEs study, Adverse Childhood Experiences Study. How many people have heard of it? Put up your hand. So it's a pretty important sort of landmark study. It was done in 1997 by the CDCs, where they looked at 17,000 people from Kaiser Permanente. And the question was, how many of them had experienced a seriously adverse experience in childhood? And they had a list of 10 of them, and it could include having been homeless, experienced violence or neglect or abuse in the family, having experienced a sudden loss of a caregiver, things like that. And they had 10 of them, and then they would just count how many you have. And if you had, if you had 2 of them, your ACE score was 2. If you had 3, your ACE score was 3, and so forth. So they found that about 40% of people had more than 2, which was surprising to them, and 25% had more than 3. Over the years, this similar study has been done in about 24 states. Roughly speaking, the statistics are national. They're common from state to state. There's just a lot of young people who have had serious adversity in childhood. In recent years, people who have studied child development have started looking at this through the lens of what they call toxic stress. How many people have heard of the phrase toxic stress? So toxic stress is basically, it was coined at Harvard at the Center for the Developing Child. The idea that if young children have too much stress on them when they're developing, and it's unbuffered by an adult who makes them feel safe. You can have a lot of stress in your life, by the way. You can grow up in a war zone and develop okay, as long as you have someone who helps you manage the stress so that you can get to a calmness. But if you don't, and you're constantly sort of in an elevated state of stress, it can really have a big effect on how you develop, and it can cause you to have difficulty regulating your behavior, regulating your having good executive functioning, planning, concentration skills, and so forth. So in a number of cases, I've done stories, and I've heard the same story over and over again. Luke is a character that I wrote about in one story. It's not his real name. The story that happened to him is he was doing fine. He showed up in social services agencies one day because he was being kicked out of his preschool. He was being expelled from preschool. Okay, now that sounds crazy, but in the United States, there's this thing called preschool expulsions. It's actually, it's been studied. The researchers at Yale have found that it's 13 to 30 times as common as K-12 expulsions or suspensions. Basically, kids, normally 4-year-olds, doesn't happen as much with 3-year-olds, but 4-year-olds being kicked out of a preschool program because their behavior is unmanageable. They're biting other kids, or they're hitting their peers over the head with fire trucks and things like that. So, you know, when a kid is being expelled from a preschool, that's a problem. Now, if you think of the lifelong effects of that, the research on ACEs is very sobering. If you have a high ACE score, if you have a lot of adversity, it correlates later in life with dropping out, using drugs, getting pregnant as a teenager, getting into bad relationships, experiencing violence, experiencing depression, suicide, and then later in life, higher elevated rates of heart disease, cancer, diabetes, liver disease. You know, pretty much almost everything that's bad gets worse with this thing. So it's sort of a skeleton, not a skeleton key, but it's sort of an early indicator for a lot of the things that we've now been reading about in the last couple of weeks in the papers, which is these rising death rates of people in the United States because of suicide, alcohol abuse, opioid addiction, or overdoses and so forth. There's just been 2 major studies that have come out on that. So Luke was, you know, Luke had an experience. Why did he show up in the child service office? Why had he been kicked out? He'd been fine. Well, it turned out about a month and a half earlier, his father had been arrested. The police had literally busted into his apartment while he was watching TV with his parents, and they, you know, with guns blazing, well, not blazing, but guns drawn, and they dragged the dad out. He had been selling drugs, and Luke was scared. He was hiding underneath the table. His mother went into a depression after that. Plants died. He essentially was abandoned for several weeks. And his behavior manifested in rages and attacks on other kids in the daycare center that he went to. So basically you look at a situation like this and you say, okay, what would happen with Luke, or what happened to Luke in terms of, you could look at his life or his health or whatever frame you want to look at it, if the situation then is just treated as if he doesn't get help, the help that he needs. And you can have the trajectory of all those negative things that we talked about. But fortunately, and this is sort of the theme of the talk, is I write about solutions, so I've thought about young children like Luke and many others that I've met over the last couple of years, and all of the landscape of remarkable solutions that have emerged over the past, many in the past just 10 or 15 years, to deal exactly with this kind of problem at many different levels. And there's actually just extraordinary ingenuity out there in our society to help young kids like Luke. So I'll just give you an example. There's a program called Head Start Trauma Smart that I've written about a number of times, and it's in Missouri actually, and partially in Kansas as well. What they do is, if a child like Luke comes into the Head Start and they can identify that there's some issues related to trauma, they now know what to do. And in some cases, there's early evidence that they're able to help kids like Luke get much better at calming themselves down and regulating themselves. And I'll sort of explain what had happened. So what is the most non-evidence-based thing that a parent or teacher could do to try to correct bad behavior? We've all done it. It's called a timeout. You get a timeout, okay? So if your kid is fine and you give them a timeout and go sit in the corner, that's okay. But if you're actually dealing with a child who has had trauma and whose basic condition is to feel profoundly unsafe, telling them to go sit by themselves in the corner facing the wall doesn't make any sense at all, right? It's actually, you're putting them alone. And in fact, that's what the researchers have done, and they've integrated that into the Head Start Trauma Smart model. And so what they do is they say, okay, this child feels very unsafe. This child it feels very, or as the children would describe it, my body feels very hot. So what do you do? Well, the first thing you do is you have to join with the child. You have to show the child the child's not alone. So there's this whole process of attunement. And you can do it with a child by saying something like, I see how angry you are. I see how upset you are. Your fists are all balled up. Your face is scrunched up. Boy, you're upset. So you join with the child. And then you can validate the child because they're always being told they're bad, typically. And you can say, I can understand why you're so angry. I'd be really angry too if somebody took my block. That's not a nice thing to do. And then the child is able to relax a little bit because it's now joined with an adult and it's now being told that it's normal. He's being told that he's normal. And then you can get into problem solving with Luke, and you can say, but since we're here at Head Start, we're not allowed to hit people, we can't do that. So let's try to figure out something else we can do when our body gets hot like this. And then they have a whole bunch of potential solutions. And the solutions may include, we have crunchy snacks, we have the beanbag chair, we have the calm down corner, we have the bendy Gumby dolls, we have Velcro strips, we have classical music and headphones or soft music that you can listen to. And then Luke might say, no, I just want milk. He'll come up with a solution. And so this has been applied in a number of settings, in Head Start programs, in K-12 programs, K-5 programs, also in high schools and middle schools, in a variety of different ways, but essentially what they call trauma-informed or trauma-sensitized care. And the results are very good. They're not, you're not able to completely take away the effects of, obviously, early childhood adversity, but what happens is, a boy like Luke, and this, typically what will show up as the early signs that something is better is you will have fewer nightmares, is Luke will wet the bed less, that's what the parents will say, and then eventually the teachers will say, oh, he has a friend now, he has his first friend, and then a couple of weeks later, he knows the first 10 letters of the alphabet, and you can begin to see that as he's and Luke now is putting up his hand and tugging on the Head Start teacher's skirt, saying, my body feels hot. Can I go into the calm down corner? And then the teacher says yes. So Luke begins to recognize his own dysregulation when it happens, because he gets triggered easily. Hypervigilance is sort of the condition of a child who's experienced this. And then he's able to sort of learn how to calm himself. And he's created his own calming response, and the adults are also very supportive of him. So in K-5 schools that have done this in Massachusetts, you see a 75% drop in office referrals. Okay, kids have little flags on their desks. The one flag might mean, my body's hot, I would like to go to the mailroom and get the teacher's mail. Another might mean, I'd like a crunchy snack. Another might mean, I'd like to go for a walk in the hall or something like that. And the kid will just put the flag on the desk, the teachers will nod, nothing will be said, and the child will go handle his own emotions. And the kids actually learn, and the teachers learn about the neuroscience. So if you're a Head Start teacher in this program, they teach you, this is really what happens. This is what happens to this child neurologically, and the teachers learn about this. Something really fascinating about this is that many of the teachers in Head Start programs also have high ACE scores. Many of the parents also have high ACE scores. So does the bus drivers, so do the cafeteria workers. You're talking about whole communities in many cases that have had many similar experiences and are often co-triggering each other. So it's really important for everybody to have the same knowledge. And when they do trainings, the bus driver gets to sit in and learn about the neuroscience, because it turns out the bus driver is the first person to see Luke when Luke is coming to daycare that morning, and immediately is thinking, I wonder what his experience was last night. I wonder if he slept last night. How's he feeling when he gets on the bus? So you can begin to see that. Now this seems like a long way to go to behavior change, but it directly relates to all of those things we talked about, addictive behaviors, depression. Now let's look at Luke's mom. Why did Luke get into this situation in the first place? The main thing that really happened to him, two things. One, he witnessed something that was very scary to him, but his mother went into a depression. And people who study child neglect will tell you that by far the biggest category of child neglect is maternal depression. When the mom is really not able to really attach with the child and be there in a supportive way, it's very, very traumatizing, can be very traumatizing for a child. Depression is the largest health problem for women in the world. The World Health Organization says, in terms of lost disability-adjusted life years, that's the biggest problem. Perinatal depression, which is depression that is associated with childbirth, is not necessarily hormonal. It may begin when a mother is pregnant. It may even have begun in adolescence and be triggered by social isolation or the added pressures that happen during pregnancy or just after a baby is born. So there's a sort of a continuum, and it's twice as high for people who are low income and from vulnerable populations. So you think, wow, maternal depression. This is a really, really big problem if we want to make sure that kids have the sense of well-being that will help them and their brains to develop well, so that one day when they read the warning label on the food that says that this has too much sugar in it, that's actually a priority for them. They're in an emotionally controlled place in their lives that they can actually make informed decisions in that way. So there's a whole alignment. So what do we do with maternal depression? I learned about that. I said, who's doing anything about maternal depression? It turns out there's actually not very much being done about maternal depression. There's only a few states that require it as a screening. I don't know exactly how many. There's very few primary care providers who actually screen for maternal depression proactively. The number one primary care provider for most women is a gynecologist, and there's very few practices that preemptively will screen for it. It turns out when they do, there's a good program in Washington State. The University of Washington has run in 2 sites. When they do proactively screen, if a woman fills out the Edinburgh assessment and the score is high, they immediately provide a caregiver and try to figure out what can be done. One thing is they don't give the woman a referral, because they find that the majority of those get left in the trash can even before they leave the office. What they do is they talk to them about the situation. They explain how it could potentially affect the child, which is very important. And then they really find out from the woman how she would like to think about this. What are the various options? And there's everything from different therapeutic approaches to medication, if you want to be on medication. Some women absolutely don't want to be on medication when they're pregnant. Others are open to it. Some are open to a more of a therapeutic approach. It turns out that this program has actually been quite helpful in reducing the predictive onset of maternal depression after childbirth. There's also some programs in Canada that have actually done telehealth services for women who are at high risk of depression because of past episodes of depression. And they found that even phone calls from other women, from other mothers, or from nurses or nurse practitioners, even a dozen phone calls can be quite effective in reducing the risk level for maternal depression. If you think of the impact that it has on a child and the child's lifelong health, the ability to make choices down the road, it's a hinge moment in someone's life. And then I thought, okay, so we have some stuff happening at the K-12 level. There's a really good movie called Paper Tigers that Robert Redford's son, did, looking at Lincoln High School in Washington, looking at what does a trauma-informed high school look like, where literally all of the kids in the high school were put there because they were kicked out of other schools for their behavior. And they takes you through what does that look like and how it can bring many people to a point where they're able to make much better decisions vis-a-vis their behavior and their studying behavior. If you go beyond, the schooling environment, you can look at, say, communities that work with foster care youth. I know you have a big foster care program. One program in the United States, Youth Villages, which started in Tennessee, has found that actually sharing some of this information with parents through an interstep program can often take a child who is at risk of being put into the foster care system and perhaps moved around a number of times, because the average movements are the very high number of moves in that system, can sometimes stay with a family if the family gets a blanket of support and the parents actually learn some basic things about parenting. Now, it's very interesting. So I thought, okay, what do we know about parenting? What can we teach parents in situations like that? Well, it turns out there's actually some very good evidence-based or evidence-informed initiatives around the country that are very good at helping parents do better with young kids who are kind of at risk. So one of them is called Child First. It's in Connecticut. And they use a model called parent-child psychotherapy. And basically what they're doing, if you really boil it down, is they're helping a young woman, very often who had a terrible experience herself, really was parented, not in a very enlightened way, to discover joy in parenting. That's really what it gets to. They help them discover the pleasure that they can get through parenting by discovering, one, that when a child is acting up, the baby's not bad. There's no such thing as a bad baby. It doesn't mean that they themselves are bad. They learn that getting down on the floor and playing, is not a sign that they're immature, which is what many young mothers feel. It's actually a sign that they're doing the smartest thing. And these programs can have a very big impact over a short amount of time in changing the bond relationship. And that child and that mother, the child is much less likely to have aggressive problems down the road in school, and the mother is much less likely to continue to have depression. So you have a 2-for-1 from that. I interviewed the program called, the founder of the Triple P program, the Positive Parenting Program, which started in Australia. It's been around for 30 years, a guy named Matt Sanders, and I said to him, if you could teach me good parenting, I have a 12-year-old son, if you can teach me good parenting while I stand on one foot, what would it be? What would be the one thing you could teach me? And so he said, parents should catch kids doing the right thing and let them know they see them doing the right thing. And they should do that every day. It doesn't matter how troublesome the kid is. Catch kids doing the right thing and let them know you see them doing the right thing. And he says, this is the most powerful intervention I've ever seen with kids. So I interviewed a social service worker in San Francisco who was implementing this program with a bunch of mothers and teenagers, not always mothers, mainly mothers, but some fathers too, and their teenagers, because the teenagers had behavioral problems in school and had, in some cases, gotten involved with violence. And the woman who ran this program told me, she told me this powerful story about a mother who had come in the weekly sessions where the people get together to discuss the past week and how did it go. And this mother said, she had been using this technique of noticing what's working, pointing out, catching my kid doing the right thing, and she had been doing this with her daughter, who was 15 years old, for about a week. And she said that weekend they went for a walk in the park, and it was the first time that her daughter, since she was 4 years old, took her hand while they were walking. And the mother, was very, I'm getting emotional just remembering the story. The mother was obviously very moved by this. Everyone else in the group was moved by it. It's incredibly powerful stuff. And it directly relates to what happens with all these decisions we have to make about what we eat and whether we exercise and whether we're in safe relationships and all of those other health things. Another example that I'd like to mention is just, I don't know if we're living through a mental health crisis in the United States, but the statistics on how many young people seriously consider suicide or have suicidal ideation or consider themselves extremely anxious when they do college and high school surveys are very high and pretty alarming. I mean, they're almost always in double digits for serious suicidal ideation or serious anxiety. So, something's happening, okay? This is something that's absolutely fascinating and troublesome, and we don't have any systems at all to deal with it. We have these things called hotlines, crisis hotlines. What percentage of young people use a telephone crisis hotline? Does anyone have any sense of that? 2%. 2% of young people say they're going to use a telephone crisis hotline. What percentage of young people, the most protective factor for a young person who's very anxious or is maybe is thinking about suicide, the most protective factor that has been shown is to talk about it with an adult and ask help from an adult. Only about 15% of young people in that situation do that. So you have this yawning gap between what needs to happen and what's happening. So how do young people communicate? What's the thing that they do most of the time? They're texting. So the crisis text line was born, and it was born out of an organization called Do Something. DoSomething.org is a huge network of young change makers. They have 4 million telephone numbers of young people, of youth, and it's all about social change and so forth. And the idea of the crisis text line came into being because the person who ran this program, a woman named Nancy Lublin, every once in a while would get a text instead of, I'm going to participate in this week's campaign to clean up the river, which is a lot of the stuff that they do, is, I'm being abused by my caregiver, or I'm being bullied at my school, I don't know who to talk to. And they would get texts like this, and she wouldn't know what to do with it. So she realized they would get so many of these texts, they would refer them to some agency that was better able to handle this. but the results weren't good. So they realized that the kids like to communicate with texts. So they started recruiting volunteers. They did research for about 1.5 years to figure out what would be a good crisis response that would be text-driven. And they started recruiting volunteers from around the country and training them to do that. I wrote an article about it when they had fielded about 8 million text messages. I'm not sure how much they've grown, but I think that they've probably doubled since then. The most fascinating things is that this service, because it's all text-based, has an extraordinary analytic capability of seeing what kind of responses work well, because you can immediately see if the young people stay texting, that means that they're engaged. If the text messages elicit the kind of responses through natural language search, you can see whether or not they're engaging in ways that's a helpful conversation or not a helpful conversation. You can also diagnose many of the problems. It turns out that eating disorders spike on Sunday evenings. Sexual abuse spikes during the summer months from 6 a.m. and 9 a.m. in the morning. Substance abuse spikes at 5 a.m. So there's a whole analytic capability of understanding what's really going on with all of these people through their text messages. 40 to 60 messages over a 45-minute period is an optimum conversation. Below that, someone probably dropped off prematurely. After that, they're probably hanging around and you haven't really answered their need. A crisis intervention is not therapy. It's just supposed to get someone out of a hot frame of mind to a cool frame of mind so they don't do something rash. That's all it is. And if you have a rapport, to perhaps refer them to assistive services. Who are the best crisis responders? Who are the best texters? Vietnam vets are terrific at being on the other end of the texting. Young gay women are among the most successful texters, and they rate them based on whether or not someone at the end of the conversation answers yes or no to the question, do you feel better now? That's all. 1 is a yes, 2 is a no, and based on those statistics, they're able to have tremendous insight into what's really going on with young people in the United States. It's really, really fascinating, and it's only 2 years old. It's just being born now. It really gives me a sense of the extraordinary capacity for change that we have. Now, as I've been thinking about all of these stories around Luke, I've thought about, the depression piece, the parenting piece, the K-12 piece, the play piece, the suicide prevention piece. Then there's the violence piece, and you'll find that many communities are doing much better addressing what is becoming known as urban PTSD, which is the fact that many young people come in with symptoms that look a lot like PTSD in the military. They're getting better at that. You see some court systems getting better at what they call rapid referral, where somebody comes in, clearly has a drug problem. They don't go through the whole mess of arraignments and 6 months and 11 months and will this person return. They just basically say, you have 5 minutes. If you get into that program, 5 minutes later, you'll get a much better deal than if you have to go through the court process. The state of Vermont has done this, and they've had very, very good success with that. You see programs called procedural justice now, which are beginning to spread, where the essence of procedural justice is the judge is nice. The judge basically says, please, thank you, compliments people on their clothing, if they show up. It's just kind of like changing a courtroom from a place of somebody standing up here telling you what a waste of a life you are, to somebody who's really engaging in a partnership. And they find that the young people often voluntarily do things that people thought that they wouldn't do. They're much more likely to comply just because people treat them with dignity. So there's sort of a really core behavioral insight in that too. So then we get to decarceration and what's happening here. And of course, if you have fallen through every one of those cracks and none of those things have worked, then you get into smart decarceration and getting somebody back into society. And all of these things, of course, directly get to all of the behaviors that affect health. So this is just a subset, but I think what's really fascinating about our time in history is that there is so much creative adaptive responses to what clearly are a whole variety of interlinked health challenges that all get back to this question of behavior change. It's all really about the same thing. And in looking at many of these programs, I've found a lot of, quite a number of patterns, but the ones that really stand out, I'll just draw out 3, is it's so much easier to work upstream. It's, you can do so much with Luke. In 2 months, he was responding to a problem. But if you are responding to the high school kids at Lincoln High School, it's much, much harder. James Heckman has said, it's 10 times as effective to try to deal with issues in the family when the child is very young. I mean, in terms of, the return on investment, so to speak, dollars spent. It's as you go down the lifespan, it's much harder. And of course, when the person who has had of a lifetime of dealing of, perhaps they went through depression and perhaps that caused them to smoke or drink, and perhaps that caused them to get into an unhealthy relationship, and perhaps that led them to be very stressed out, and then at the age of 50, they land in a hospital with, end-stage renal failure or whatever it is. It's just, the problems really compound. So upstream really, really makes a lot of sense. And if we look at the way we invest our money on healthcare and on some of these behavior change things, we'll find that that is not reflected in expenditures in any way. The second one that I found over and over is that there's a lot of knowledge that when schools or Head Start programs or social services begin to understand what's really going on here, especially with young kids who have had severe adversity, is it's not enough to just give the knowledge to one person. It's not enough to just let the nurse know or to let the teacher know. They let the bus driver know, as I said before. They let the parents know. They let the sisters know if the parents are not the ones. In many cases, as is in high school students, they let the students themselves understand, give them the neuroscience and the knowledge to understand what's happening with their own behavior. Why are they reacting this way? Is it because they're crazy or they're a bad person? Or is there something that they need to understand about their own patterns? And it's really powerful to give people self-knowledge in that way, the science about how they're behaving, which gets back to really the last insight that I found is so powerful is the really effective organizations that I've written about. And, in the last 5 years, covered more than 200. They're always asking people how are they solving their own problems? And not only are they asking high school kids or the nurses or the teachers, they will also ask the 4-year-olds, how can you solve your own problem when you're hot? And it's remarkable how when the system lets that information into the system and it actively tries to capture that information, what works for what works for you as a patient? What's the best way that you found puts you in control in this situation? People will often come up with very surprising things, and when systems integrate that knowledge, especially by noticing the positive deviance in a system where success is happening, they can capture a tremendous amount of insights about what really works in behavior change. So just to finish, there's I was talking before about Dan about what is it in certain people that causes them to make better decisions. And there just seems to be something that happens in people's lives, and it can happen at any age, but it's better if it happens younger, when they get a sense of their own ability, they have the capacity to aspire to a better life. And they can see it for themselves. They see that possibility is real in some way, and they have somehow a sense of efficacy that they have some power to move themselves in that direction. That is the core thing that I found over and over, just in interviews. It's not a scientific analysis by any means, where people have said over and over to me, I just felt that I could do something. I didn't feel it before, and something came along. A teacher, a health worker, someone helped them understand that they had the efficacy, and it gave them the desire to aspire to something different and a sense of hope that was possible. So I'd like to end just with a quote from Doris Lessing, who, a great novelist and Nobel Prize winner. She said, she wrote in a book called Prisons We Choose to Live Inside, which was a lecture she gave in Canada. I think when people look back at our time, they'll be amazed at one thing more than any other, that we do know more about ourselves now than other people did in the past, but that very little of this knowledge has been put into effect. I think what's so great about this partnership is it's really all about taking that knowledge and putting it into effect through a very powerful company and distribution channels reaching millions of people, and I find that incredibly exciting. So thank you very much. Yeah, if there's, we have time for a few questions if anyone wants, or we can just. I have a 12-year-old son, and I have tested out these ideas on him.
Are there things that you know that you should do, but you find it very hard to actually do?
So after I interviewed Matt Sanders, and he said, catch kids doing the right thing, I became aware of how often my attention is focused on when things are going wrong with my son. Not with my staff. I have a staff of 12 in our organization, the Solutions Journalism Network, and I'm a much better CEO than a dad, I would say, in terms of my ability to sort of catch employees doing the right thing. But with my son, I would find that my energy would be bigger when he was misbehaving than when it was when he was behaving. And I thought, that's interesting. I'm bringing more energy, and energy is a form of feedback, the amount of energy and attention to the things that are really aggravating me than the things that are delighting me. And I thought that's the main thing that I have to switch. And I tried switching that. I have tried to switch that, or at least be aware of it. And it's fun. It's fun to notice that you can bring energy to something and bring humor into things like that. And it really does make life more pleasant. You have kids?
I have kids, I have lots of mistakes, but thankfully I'm not allowed to make a lot of decisions in my kids' life.
Yeah. So, okay, thank you very much.